ACL tears can occur while skiing, while playing soccer, while playing basketball, but not just with sports. I've seen patients that have torn their ACL just jumping up and down, high-fiving someone else, or even stepping off of a curb. The ACL stands for the anterior cruciate ligament. It's a ligament that is found deep inside the knee, and it's critical for the stability of the knee. Not everyone who has had an ACL tear, though, is appropriate for surgery. So these exercises are for those who have chosen not to have surgery. So after your ACL tear, you'll notice a lot of swelling in the knee, but also the quadricep muscles, the muscles in your thighs, will be inhibited. It'll be sluggish. The muscle contractions won't be nearly as good in quality as you noticed on the other side. So what we're going to do is called a quad set. So for a quad set, you'll have your legs straight, your toes pointing up towards the sky, and if you can gain this full knee extension position, then you can just start right there. And what you'll do is press your knee down into the table, so actively pressing using the muscles down into the table, pretending like there's something behind your knee that you're squishing against the table. In order to do that, you'll notice that your thigh muscles contract, so the quads contract, hence the quad set. Now we do this for a 10-second hold, and then after 10 seconds you relax, and then contract, push your knee down into the table, hold, relax, and you'll notice probably that the quad starts to shiver, fasciculate, it's going to quiver, which is fine because that connection with all the trauma that's happened in the knee has affected the quality of the muscle. So we're going to hold that for 10 seconds each time, and we'll do 10 repetitions. Now, if you cannot get your knee straight, that's okay. You just grab a towel roll. So roll up a towel, put it beneath your knee, which will give you a little bit more bend in the knee. And then you can try to squish the towel roll, and that'll be much more comfortable on you because it won't require you to get that full extension. Our next exercise is going to help restore the bending ability of the knee. So this exercise, you're going to lie on your back. I'm targeting my right knee for this one. It's called a supine heel slide. And you'll do it a couple times during the day, so typically in the morning and then in the evening if you're already lying in bed. This works pretty well. But what you'll do is you'll just actively try to slide your heel towards your butt, which actively bends the knee. But since the knee is swollen and stiff, you're not going to be able to get all that far. So just go right up to the edge of that kind of stiffness, pain, tightness, pause there, and then slide it all the way back out, kind of actively straightening the leg. And then repeat that 10 to 15 times, and each time you're just trying to push in just a little bit further, so really trying to restore the bending ability of the knee. Now, if you're just struggling with that a whole bunch, then grab either a dog leash, and you can take the loop part of the dog leash, or if you just get like a cargo strap or some kind of a piece of rope, something rigid, tie a loop at the end of it, place it around your foot. Then you can, as you slide, you can just use your hands for an assist on that one. And so that'll just give you that a little bit easier way of doing it in the beginning. But 10 to 15 repetitions. Our next exercise is called a straight leg raise. So this one is typically pretty tough after the injury because, again, those quad muscles are not contracting the way that they should be. But this is a really important exercise. So even if you struggle with it in the beginning, it will get easier, I promise. It just takes repetition to get those muscles back online. So for a straight leg raise, you lie on your back, you'll have the opposite leg bent, and then the affected leg is straight. Pull your toes up towards you. Lock your leg out just like it's a piece of wood, a 2x4, so keep it as straight as possible. Arms down by your sides, and then engage your core to protect your spine, and lift that leg up, trying to get it parallel to the other thigh, and then lower back down. So we're lifting up, pause, lower back down, and we'll repeat that for 3 sets of 10, or at least build up to 3 sets of 10, because in the beginning, like I said, you're going to struggle with this, and that's okay. It'll come, but work up to 3 sets of 10. Our next exercise is bridging. So for bridging, you're going to bend your knees up to whatever's comfortable on each side. So even if you can only get to out here, that's fine to start with. Pull your toes up so that you're pressing through your heels, arms down by your sides. Squeeze your glutes together, so squeeze your buttocks as you raise the hips up. Pause at the top for a slight second and then lower back down for 3 sets of 10. We'll now move on to seated knee extension isometrics. And for this exercise, we're going to need a stretchy band. You can either tie it into a loop or go ahead online and purchase one of those nice loop bands that come in a loop. You'll need one that's moderate to maximal resistance. And so you'll loop it around the front leg of a chair, and then your foot, lift your foot up and kick out to about 60 to 80 degrees of knee bend. Okay, so that's right about here. And since it's an isometric, that means we're gonna kick out and hold in that position. And you'll notice that you'll feel the quads. You'll even get some shake out of it, like you see me here. And so you're holding that for 30 seconds. So, or at least we're building up to 30 seconds. If you can't in the beginning, because there's swelling and everything, you'll probably get 15 or 20 seconds, and that's fine. Start there, but we want to work up to 30-second holds and then relax in between for 4 to 5 repetitions. So remember, 60 to 80 degrees of knee bend. Our next exercise is a seated hamstring curl. It's best to use one of the flat resistance like Theraband or resistance bands. You can tie it around the loop of something heavy like a table and then another loop around your foot. But if you just want to use that loop that you used in the last one, that works as well. It's just a little bit stronger. And so basically, for a seated hamstring curl, you're just going to get some moderate tension on the band and curl your foot underneath you for 3 sets of 10. Our next exercise is mini squats. So it's basically a half depth of a full squat. So you can grab onto a countertop or a chair. I'm just using a chair here. Have your feet shoulder width apart. You're going to sit your hips back, almost like I was sitting into the chair, like tapping my butt on the chair. And you'll notice that my thighs are about half depth, right? Because if I did a full squat, you're thinking thighs parallel to the floor. So I only want a mini squat and back up. So keeping my chest up, sitting my hips back, my knees are staying over the front part of my feet. So I'm not doing this, right? This is a bad squat. My heels are coming up, my knees are going in front of my toes. That's going to put a lot of pressure on the knee. So we want to do it correctly. We want those hips to sit back. So we can do 3 sets of 10 of the mini squats. The next exercise is heel raises. So those calf muscles support the knee as well. And what we want to do is hold on to that same chair and raise up on both toes, or toes of both feet. And so I'm pressing through the ball of my foot there, raising my heels up as high as I can go for 3 sets of 10 to 3 sets of 15, depending on how it feels. If you have any questions, be sure to drop them in the comments below. But next, you'll definitely want to check out my best knee strengthening exercises video so that once you have your pain and inflammation and knee mobility better, you'll know exactly what exercises to progress into.